So this is a recurring link, so you can keep the link. Hopefully every day, every Wednesday, we can have this lecture. And we're going to start talking about advanced stuff. I know you're good in anatomy and physiology, but we can talk here when you're here. When you're in the lab, we can talk about these things. But if it's the lecture to be recorded, I'll try to get some advanced stuff. So today, hopefully, we can get talking about the advanced things in dentistry. I can talk about laser and how they how the use of laser in dentistry, how it's what's the nature of laser, how they find it, it's not really discovered, but really how they progress through laser, and what's the difference between laser and light. Okay, and you can stop me anytime if you have any question. All right, can you see it now? Can you see the PowerPoint?
Yes.
Yes.
All right, good. All right. So laser in dentistry really didn't replace any big stuff, but it makes life easier for the dentist. Like we can, when we take a brush, and remember when we make a crown on the tooth and we prepare the tooth, usually the edges of the crown will be under the gum. The gum will be bleeding, and the impression will be, some of the impressions, especially like alginate and other impressions, should have a dry feel. So when we do laser, when we do gingivectomy, the laser, the area will be very clear, and the cut will be very clean, and we can see the margin of the preparation of the tooth very clear. So the impression would be very good. Also, in laser is generally it's a heat focused, and it can be focused to the area we can cut. There's less bleeding, less infection, because also when it cut, it will sterilize. Also, it's less vibration when we do cutting of the teeth. There's some, especially when you work with kids, it will be very easier. That's the thing. So laser, it's really a future thing, but it was a solution look for a problem. So even some lighting use laser. The scanners we use are laser. The scanner, remember the 3D scanner? It's a laser point and a special light, and all these things the laser is the future. Let me talk about before the laser. We have to know about the light. The light is the smallest energy quantity that can be transported. If you remember this equation, energy, mass, it's multiplied by speed of light. So energy and mass, they are equal, or sometimes the light will become mass, and the mass can be energy. That's why when you burn stuff, become light, the stuff will disappear because it changed to energy. And till now, everybody will say there's theory about the light. It's a particle. Some people say no, it's a wave. And till now, there's people, they said no, it has a dual capacity. It can be wave and can be particle. And if you remember, there's double slit experiment. Remember that? Thomas Young, that's 1800. He put two slits and they discovered their light interfere by it. So he thought the light is, sorry, I got an email. Nothing. Oh, no, I think tomorrow on Wednesday, the visitor will come from 1 to 2. So on Wednesday, you have to come at 1 or before 1, because yeah. So you can come tomorrow in the morning. We just organize stuff, and on Wednesday you have to come at least 12:45. It's okay. Hey, if that's okay with you guys, can you hear me?
That's fine.
Yeah.
All right, good. Yeah, I just got an email that, and the tour will be just 5 to 6 minute tour. That's great. So will not take long, but we have to wait until they will come and then we can leave. Okay. Okay, so so the light have dual capacity, can be wave and can be particle, and and the wave it has, this is the shape of the wave. There's a wavelength and there's frequency. The frequency, the number of waves go through a point during certain time. So that's a wave, and one of the books said, just like Aladdin wearing, you know, he's applying on the magic carpet. So Aladdin is the particle and the magic carpet is the wave. So it's dual effect. It's wave and particle at the same time. So the nature of light, history of nature of light. Some people goes to the, you know, during Greek time, the Greek, they thought the eyes will send light. They thought the eyes will send light to the object, and the lights will come back to the eye. Ibn al-Haytham, he's Arabic. He's the guy who discovered the camera. Camera is the Arabic name for qumra. Qumra means a small room or small place. And he discovered the light. It comes from the sun and reflected on the objects and come back to the eyes. And he made dissection to the eyes and discovered the lens, and discovered the lens are focusing the light on the back of the retina. All these things. He put his book, his kitab al-Minzar. Minzar in Arabic mean telescope, where you can see. And Al-Kindi also did some of this stuff. Al-Kindi also from Baghdad, he discovered there's visual rays, and also Ibn Suhail, he put the first lectures about reflection and refractions about the light, and he made the equations in the beginning. And there's a lot of, you know, for 700 years, Baghdad was the capital of the world, from China to Spain, and it was the Islamic Empire. They have hospital, colleges, and so they always have the knowledge, because for, you know, hundreds of years of prosperous, they will have you know, progress, and because the money there and the education there and the big college, everybody will come to Baghdad, and they have all these institution. There's a house of wisdom. Is like a center of intellectual. They will come and they get paid. So at that time, Baghdad was like the center of the science. But, you know, the Mongol came. You know, they invade Baghdad, and they kill almost everybody, but they throw the books and the rivers and Tigris, and the river changed color to blue because of the ink. Anyway, and after that, Baghdad become very diminished after all these years. Anyway, this is one of these sad stories. So let's talk about Scottish mathematician called, Clerk Maxwell. He was just staying home, and he write equation after equation, and he discovered that light composed of both electrical field and magnetic field, and they propagate to where is it? So it has magnetic field is perpendicular to the electrical field, and both they are perpendicular to the direction of propagation of light. And it's all, he didn't do like experiment, he do it on mathematically, proving that. And you can see many other scientists, they did a lot of experience and a lot of discovery just by math. They just get the occasion, the occasion after occasion, equation after equation, and they fix them, and they will discover all these things. And they discover that light is just not only visible light. If you see light, the visible light is very narrow part of the whole light. The light, it's the microwave, infrared, ultraviolet, X-ray, gamma ray, and radio wave. All these are light, but they differ from their wavelength. The radio wave, the wavelength can be kilometers. The microwave, it's in centimeters. Infrared will be the microns. The visible light, it could be in the microns too. And ultraviolet will have shorter wavelength, but have high frequency. So the energy will be different. The ultraviolet become more energy than the visible light. Visible light have more energy than infrared. X-ray will be more, and gamma ray. They all these are light. They all travel on the same speed, the speed of light. But they have different properties because they have different wavelength and different frequency. The only visible light was between 400 to 700 nanometer. That's a visible part of light. So the visible light is very small compared to the other parts. Like radio wave can be as far as like a soccer field, while the smaller the infrared can be the wavelength can be as small as the bacteria. And when you go up to ultraviolet and X-ray, they will be very small, as like between the atoms and the electrons. In 1931, Niels Bohr, he proposed that the atoms contain, there's a nucleus and there's electron travel they travel in an energy level. So he proposed that. Also, no one can see the atoms, but he proposed that, and he made the energy level for the electrons travel in this energy level. So when you stimulate an atom, the electron will jump to higher energy levels, and when the atom tries to become stable again, the electron goes down, and the extra energy will be like emitted as a photon, and the photon can be visible light, or can be infrared, and can be X-ray if it's high energy. So, and then later Albert Einstein, he proposed there is a spontaneous emission, which can happen by normal fire, normal light, and there can be stimulated emission. All these he proposed them by by equations. He wrote equation, and he discovered the light can be amplified on the stimulated to make it will be more stronger light. So he made the basic of all those people. They build up to the laser. And okay, Ashlyn, I just want talking to them. We need come tomorrow. We need to organize the lab. On Wednesday, we have visitor. They will come at 1 o'clock in the afternoon. So that's why we need to come. Okay. So so the light, it's a energy pocket. It travel in the speed of light. They have amplitude, and they have wavelength, they have frequency, and this is the formula for the speed of light. Speed of light is a 300,000. Sorry, hopefully we get an email. Okay, nothing. Portion. So this is the formula of the light. There's a speed of light, it's the multiplication between the frequency and wavelength. So whenever the frequency is too high, the wavelength will be very short. Or the wavelength is too high, the frequency is it's very slow. So this is the effect. They both the radio wave, the X-ray, this all they travel the speed of light, but they have different frequency and they have different wavelengths. Okay. Charles Downs from Columbia University, he made the microwave amplification stimulated emission of radiation. He made the maser. So he's the father of modern laser, but because its microwave is not visible, he didn't get any recognition at that time. That's the problem here. Everybody will look for something visible. That's after 9 years of doing the maser, Theodore Maiman, he made the first laser, visible laser, but he got all the credit. And unfortunately, that's what happened all the time. This Theodore Maiman, he made the ruby laser. He got scientific ruby. Ruby is like a artificial gem, and he polished the edges. You can polish the edges and make them like mirrors. And you put a lot of pressure, energy force. You put this a flashlight. You can see this is a flashlight. This is the ruby crystal. And the edges, he made them so polished so that if there's a stimulation, the photon will go and come back and keep stimulating each other until in the end, one of the mirrors are partially emitting. So in the end, we'll send red light with laser light. So he got all the recognition because he made the visible laser. Well, Charles, he made the maser, which is infrared, but he didn't get any recognition. Immediately, all the technology and all these big university jump on that, and after that, they made the helium neon laser. They made the CO2 laser. It's all you can stimulate the material. You stimulate the photon to go up and stimulate them, and they go down and they stimulate each other, or they call it population inversion. And then you will get at the end a powerful laser. So the laser is a device produces a very powerful narrow beam of light. The beam is thin enough to drill holes in a spot in a tiny as head of a pin. It can be focused because it's already focused. It's already very thin. It will be monochromic. It can be one special light. It can be green, red, or infrared, or ultraviolet. And the difference between laser and light, it's okay. The normal light, let's see the light from the ceiling here. It has a different wavelength. Like, so we see it's a white light, but usually it composed from different wavelengths, different red and color. If you put the prism on it, you can see there are different colors. While laser is usually monochromatic, is usually one color. And CO2 laser, it's infrared and not visible. If you do a helium neon laser, it's red. Most of the diode laser will be invisible spectrum. The normal light is not focused, unorganized. All the wave in different direction is not in phase. While the laser is more organized, the intensity will be accumulated. So this is how to measure the energy, but by watt on the centimeter, cubic centimeter. So the energy of the laser will be very focused. So that's why we can use it for cutting, for sterilization, for anything. So that's the difference between normal light. The laser will be monochromatic. The normal light will be different color. The laser will be directional, will be pinpoint to one spot. The normal light will be in different direction. Coherent, it's the same wavelength and same base, so the energy will be concentrated, while the normal light is a different wavelength and the energy will dissipate it. The normal light can be in the ultraviolet, it can be invisible, and it can be in the infrared. While the laser, it can be directionally, can be in one direction, and will be in high intensity. The energy will be focused. Monochromatic is the one wavelength. There's maybe a little bit range of wavelength, but will be when it's green, it's a green. When it's red, it's red. When it's infrared, it's infrared. And most of the LASIK surgery, when they do LASIK for eyes surgeries, vision correction, they are in ultraviolet. They are invisible, but they are monochromatic, so they have the same energy. And coherent mean when the wave comes, the top of the wave comes with the other top of the wave, and the lower part of the wave will go with the lower part of the wave. So they augmentate each other. So the force will be by adding each other. While if it's different wavelength, they cancel each other. That's why the laser have the power. Oh, if you're interested in this, I'm telling you about the spontaneous emission. Spontaneous emission, how the photon comes. Imagine you heat something. You heat a piece of metal. The electrons that's flying around the nucleus will get energy, and they will jump to the higher level of energy level. But the nucleus try to go back to the stable condition. The energy will be released as a photon, and the photon energy is the difference between the first energy level with the second to the lower energy level. That's why you can measure it. This is the spontaneous emission. That's happened with the normal light. The normal light, you stimulate the tissue stimulate a metal by heating it. It will glow, but it will emit normal light. So the theory of laser, you stimulate it's when you hit an atom which is still stimulated, it's still excited, which the electron is in the upper part, and you hit it with one photon, it will end by two photons with the same wavelength and the same energy. And these two photons will hit another one, and will make three. The end, they will hit another excited atoms. It will end with three photons of the same wavelength, same energy, and the process continue. This is called excitation, and you stimulate all the atoms in the material, and you get them almost all of them to the higher level. And when one go down, it will stimulate the other until we will have multiple photons. They travel in the same direction, the same wavelength, and the same energy. And with the laser, they have two mirrors, and they go and come back until they stimulate each other and make the energy faster. So typical laser has a three main part. Usually dental laser have energy source. Mostly it's flashlight. Substance called active laser, like helium neon laser made of helium neon. CO2 laser made of the gas CO2. Or structure that's housed, they call optical cavity, where there's two mirrors stimulate each other. And control panel, we control the speed, the energy, the heating system, all this, and the cooling system. All these, it's available in the laser machine. I think this is a picture of the resonator. Resonator is the optical resonator where the stimulation happens. There's one laser medium called Nd:YAG. Neodymium is the active medium. YAG, yttrium aluminum garnet, is the host. It's just it's host the active medium, and the stimulation is going to be flash lump, very strong power light. It will stimulate it, and there is two mirrors. One is highly reflecting. One mirror is 100% reflecting. The other one is partially reflecting. So when the photons go and come back, stimulate each other, in the end, we will have part of the laser energy will go out. And that's the called resonator. And the resonator have two mirrors. I told you one of them is highly reflective. The other is not really a highly 100% reflecting. And usually the photons that go in the direction of the mirrors will end to get energy. The other photon traveling different direction, they will be lost. The energy will be lost as a heat. That's why laser machine need a lot of cooling system. One of the new laser is diode laser, made of two reflecting surfaces. And remember the laser pointer is made of diode laser. This is an example of helium neon laser. These two, both of them, these are a flashlight. And this is the active medium. And when you stimulate them, the flashlight will give a lot of energy to the area, to the photons, to the atoms to release photons here. This is another diode laser. This is story the same, talking about the stimulation of the atoms and go like photons in general. This is another example of when the atom will be excited, the electron will jump to the higher orbits, and when it comes back, it will release light. This is called spontaneous emission. But when you stimulate that, it will stimulated by different atoms stimulate each other. We will have light amplification. We amplify each other by stimulated emission, right? You stimulate the emission of each one until we'll get the final radiation. And always we have a cooling system. The lasers generate a lot of heat, so we need a cooling system. Also, we need the cooling system around the tooth or the tissue. Sometimes some laser they use when they have a laser beam around the tooth, there's water and sometimes air, cold air. It will spray on the tooth, on the tissue. So we will damage only the tissue need to be destroyed by laser or cut. And also this control panel. Control panel is very easy. It's self-explaining. You have the speed, we have the pulse, we have the energy, and we have the handpieces, the different handpieces. I forgot to tell you about different light. They have different light wavelengths. They have different properties. Normal light can be transmitted by fiber optics. You know, it's fiber optics. When we do fiber optics by the internet or anything else, it's the normal light, the visible light can be transmitted by fiber optics. While far infrared, like CO2 laser cannot be transmitted by fiber optics. So you need articulating arm, you need the mirrors. So when we work with the CO2 laser, we use mirrors. Usually has a tube and articulating arm, while erbium YAG and Nd:YAG, and you can use flexible fiber optics. And the good thing with fiber optics, you can touch the tissue. You can feel it when you cut the gum or you cut the frenum. you can feel it. You feel the tactile sense. While when you have articulating arms and you have the handpiece is not touchable and not touching the tissue. That's the difference between this is articulating arms has mirrors angulation, and this is the fiber optics. So it has fiber optics, you can feel it, you can touch the tissue. Also, when imagine you work with Nd:YAG. Nd:YAG, it's in the infrared. CO2 is in the far infrared. They are not visible. So we need another laser, which called aiming beam. Aiming beam is another laser. It's usually low energy laser that can tell you where's the cutting will be. So there's aiming beam and there's active beam. All the infrared or ultraviolet lasers, they have aiming beam. Aiming beam, where is the tissue there, or where is it going to cut? So the aiming beam is always there. When you start doing the active beam, usually there will be a sound. Maybe I'll show you the video how the sound will be. And most of the laser, they have now a key, so no one can operate the laser accidentally. And some laser, argon laser is the blue wave laser, and sometimes they use it in gingivectomy. Nd:YAG, neodymium, aluminum, yttrium, aluminum garnet. Usually it's in the infrared. And some laser, active lasers, they are cutting. Some laser are used for physiotherapy. I have a picture. This is that laser. It's one of the cheapest, about like $3,000. And used for gingivectomy, frenectomy. When you do a crown bridge, you cut the gum around the tooth. You can use this. There's erbium YAG. I worked with the erbium YAG as one of the expensive ones, but the good thing with the erbium YAG, its location, the wavelength, it can be absorbed by the hydroxyapatite. Hydroxyapatite is the basic structure of the dentin on enamel and bone. So it's one of the best cutting hard tissue. Also, it has a fluorescing effect. So imagine people have calculus or tartar on their teeth, on the root of the teeth. This one has a diagnostic effect. So when you put the handpiece there, it will send a special light, regular light, and when the fluorescent come back as a calculus, it will send energy to remove the calculus until it reach healthy tooth structure. When it reach healthy tooth structure, the fluorescent will stop and will stop damaging the normal tissue. That's the thing. It has a diagnostic effect. That's why it's very expensive, but they use it for gum disease and for cleaning of teeth. This is CO2 laser. CO2 laser, can you see this is articulating arms? They are articulating arms because of the wavelength is too far in the infrared. We cannot use fiber optics. Other thing with the CO2 laser, and this wavelength, it's highly absorbed in water. So every tissue has water, but so when you different percentage, the gum have more water than the teeth. But because of high energy, it's going to be one of the best laser cutting laser in surgery. So that's why the CO2 laser, one of the best one for cutting incisions, cutting tissue, evaporating lesion. That's a CO2 laser. Let's talk about laser tissue interaction. Usually the laser tissue interaction, we need laser to be absorbed. The laser can be absorbed, can be transmitted, go all the way, can be reflected, which is very rare, can be scattered. Scattered, that's we can use that when we place, there's a bleeding in the area. we can use Nd:YAG. Nd:YAG can be absorbed by protein. So protein, all the red blood cells have protein, and they will get the heat so they can stop bleeding. So the laser light can be transmitted, can be reflected, can be scattered, or can be absorbed. The best thing is going to be absorption, is the main effect that we can do a lot of procedure on when we do absorption. This is very important to know which laser you're going to use. This is the wavelength. This is the wavelength. The wavelength can be from here, can be visible. 532 nanometer is the visible part. 400, 800, all these are visible part. These infrared, when it's 2000, it's nanometer is the infrared area. This is in the far infrared. And you can see there's water. We have here the less absorption of water. Here, there's the highest absorption of water, CO2 area. And we can see there's melanin. Melanin will absorb by Nd:YAG. So sometimes people complain of their gum is dark. We can treat them by Nd:YAG. Nd:YAG will be absorbed by melanin, so we can make the bleaching of the gum if it has a lot of melanin. Also, when we have the enamel is going to be here around erbium YAG. Erbium YAG, because of the hydroxyapatite crystal made of enamel, so erbium YAG is better for cutting enamel and dentine and collagen. Well, the best one for cutting all the tissue, because they have water, is the CO2 laser. So whatever you want to stop bleeding, see the hemoglobin absorb green light more, and Nd:YAG will absorb more protein. So all these things you can choose what type of laser you're gonna get and which wavelength you can get with that. I told you, when there's absorption, most of the effect of laser is heat. So this is all the science they use centigrade. So when it's 37 is a normal temperature. When it reaches 60 centigrade, there will be no visual changes on the tissue. It just heat them. And usually there's warmer, hyperthermia. This, we can use it for physiotherapy. The muscles will stimulate, the muscle will be relaxed. They have more blood blood vessels, more blood supply. If you heat them until 60 centigrade. Over 60 and 65, we will have coagulation of a bleeding. If there's a bleeding, we have coagulation, we have blanching.
Unknown number.
And over that, from 65 to 90, we have denaturation. You know what denaturation? Denaturation, when the protein will change to different nature. Imagine you're cooking an egg. The egg is liquid, that is protein. When it put it on the pan, on the frying pan, it will change to solid. What happened to the protein is denatured. That's what denaturation of the protein. And you know, the water boiling is 100 C, 100 centigrade. And after 100 degree, when you heat the tissue until they reach 100, you will have a drying, and we have a cracking in the tissue, especially if you heat the enamel. Enamel has a small small water in it, and when you put laser tissue on CO2 laser on the enamel or dentin, the water gets boiled inside the crystal, and it will explode and make small holes in the enamel or dentin. And after over the 100, you will have smoke and vaporization. All the tissue will be evaporate. And over 200, we have blackening and charring. Everything will be charred. This is another example how the temperature change can affect the tissue. So imagine you have to know what temperature you want. If you want to just physiotherapy, just relaxing the muscle, you need temperature not over the 60 centigrade. If it's more, you need coagulation of bleeding. You shouldn't reach boiling. You shouldn't reach over 90. This is, so I told you, most of the effect of laser is heat, but we have to control the heat, and we have controlled the absorption of that heat. And this is another examples of lasers. This is the visible part. Exandrite is a visible laser in the green blue area. Helium neon is in the red area. Helium neon, it has low energy, so it can be used for physiotherapy. And the YAG and the YAP, all these are near infrared. They use them for protein denaturation, for coagulation. Erbium chromide, yttrium, and erbium YAG they use for cutting hard tissue. They are in the mid infrared. We can cut bone, we can cut dentin, we can cut calculus, we can cut enamel. In the far infrared, we have the CO2 laser. CO2 laser, it's absorbed by water, so it can cut the gum, we can cut the gingiva, we can cut, there's abnormal tissue, fibroma. So the wavelength, these are these important stuff to know about laser. We have to know the wavelength. We have this emission mode. Most of the laser we use them are intermittent. They are in pulse. Some of them continuous wave, like if you want to stop bleeding, continuous. But most of the laser can use as a pulse. Laser power, it can be low power. We can increase it to cut more. Exposure time. It's both sides. If you keep the energy on the area, it will then the heat will disseminate it to the other side and will burn around the tissue. I have a picture of tooth when you put CO2 laser on it. If you leave it a little bit, it will burn the tissue around it. If you leave it more, all the tissue will burn. And this is another picture of CO2 laser. This is CO2 laser. CO2 laser, if you see the handpiece, is non-touchable. It's not touching the tissue. It's because it has mirrors. And it will affect the tissue by boiling the water inside the enamel. The enamel will explode because of the water inside its jump. So there's a thing called thermal relaxation time. All the tissue, they have a time when you hit them with the special laser, the heat will dissipate it around the tissue. So we need to measure how much time we can make damage to the point that we need to be damaged without damaging the adjacent structure. So if you make a cavity, you want just the tissue around where is the decay or caries around it. You don't want to damage the adjacent normal tissue. So that's each tissue has a different thermal relaxation time. And most of the laser we use, it has pulse. So they have different lasers, they have different energy level and different pulse time. That's the CO2 laser. See the difference between dentin and enamel. Dentin will be damaged more. Why you think dentin have more damage than CO2 laser? And CO2 laser absorbed by water, because dentin has more water than enamel. Dentin has is more softer, has a lot of inorganic compounds, and so it has more water in it. So the damage would be more, and the cutting would be more when you're using CO2 laser on dentin. And well, if you use erbium YAG, erbium is erbium, yttrium, aluminum, garnet. This erbium, the absorption will be in the hydroxyapatite crystal. So the crystal will be explode. And if you can see the microscopic effect, you can see there's a small holes around it. So erbium YAG has much better and nicer cut than the CO2. CO2, because it burns all the whenever there's water is there explode. But while erbium YAG, it's better for cutting than enamel and cutting hard tissue. Oh, this is another slide about different laser. There's low intensity. We use it for diagnosis of caries. We use it for physiotherapy, decontamination. We can do for cutting just bacteria, the decontamination, stopping bleeding, and teeth whitening. All these are low intensity laser. And sometimes, while high energy we use for killing bacteria, we have soft tissue ablation cutting, enamel ablation cutting, dentine ablation, osseoablation is osseous bone, pigmentation, we remove the melanin, and we do a combination of laser. But laser is very expensive. That's why before you have to buy a laser, you know what do you want to do with it. This normal handies for the dentist, it will cost like $100. The erbium YAG laser will cost like $200,000. But it's a fancy when you put it in the clinic. It will be very big, and you can use it. But it's expensive. When you choose that laser, you have to the budget, and you have to know what you're doing with it. So the dental laser can be surgical and non-surgical. Non-surgical, we can use it for diagnosis caries, and we can find if there's a calculus. We can use it for laser physiotherapy. While the surgical, we cut the hard tissue, we can cut the soft tissue. Depends on which laser you want. And this is like which laser and what they can do with it. I have some pictures. I will show you them. This carbon dioxide laser. This is ND-YAG. This is diode laser. This is erbium YAG, and this is the control panel. It's very easy. You can tell this is the energy. This is the average. This is the cooling water. There's a flow of water, a flowing of air. This is a frenectomy. Remember, sometime when we make dentures, the frenum is too high, interfere with setting of denture. We can cut it with laser. Look at the laser when you cut. There's no bleeding because all the blood vessel will be coagulated. And some people, they have, this is lingual. This is the tongue, lingual frenum, and this is contact, fiber optic contact, tip. It will help us to cut the tissue, and there you can see there's no bleeding, and we have less anesthesia. Sometimes you just need topical anesthesia, and you cut the frenum is too high, interfere with the patient's speech and brushing, and that's when you can cut the whole frenum, and the healing will be so fast because there's no bleeding and less audible. This is gingivectomy when you cut the gum. This is high gum level, and this is the first few days, and this is healing. And I know this is the laser will cost thousands of dollars, but you can get like a cutting blade will cost like $5, and you cut the tissue. It's a big difference. But the thing with the laser, there's no bleeding. We have just a few drops of bleeding, and the tissue will be sterilized. Those no bacteria will be killed by the heat of the laser, and the damage will be uniform. This is the physiotherapy laser. Sometimes we use it for relaxing muscle. This is on the neck. This is on the forehead, where's the temporalis muscle here. And you can put it on the TMJ. This is inside the ear where the joint here. So this is all this physiotherapy. We can use it for relaxation of muscle. This one, this broken tooth. Sometimes when you make a crown on the tooth, you need the tooth with very big and very long. So sometimes we need to cut the gum, and we cut the bone too. That's what laser erbium YAG can cut. The water lace, one of the biggest used in dentistry, the water lace, and 2,780 nanometer. It's in the middle infrared. The wavelength. This is the wavelength in the middle infrared. So there's all the laser will be absorbed by the hydroxyapatite crystal. So it can cut the cut the bone and the tooth, the cementum here. Okay. So this is another feedback. We cut the decay. Also, we cut the gum too. This is before and after. Also, we can do root canal because it sterilizes the tissue. So this is a child. You know, when they do with the child, we can do pulpectomy. Pulpectomy is a root canal for baby teeth. And this is the picture of it at the end. This is the baby tooth, but this is the adult tooth is erupting now. And we can do, they do ready-made crowns here. Sometimes people, they have the canine. This is upper canine is impacted. The canine is it's erupt in this area and near the base of the root of the lateral incisor. Sometimes it will go to the palate. And once it goes to the palate, will it be impacted? Because the palate is very hard bone. So sometimes we go to the orthodontist, the orthodontist, they try to get it off. They send it to the oral surgeon to exposure. So you can do exposure. We just cut the tissue around it, cut the gum and cut the bone and put a bracket on it. And with and springs, try to pull it down. So this is the use of laser in orthodontics. This is fibroma, and fibroma is abnormal tissue, fibrous tissue, and you can see the cut. When you cut them, there's no bleeding. There's always, when you do laser, there's always, they have safety measures. You have to, the dentist and the patient, all the staff, they have to wear special glasses. There should be protection for their eyes, protection for the tissue, protection for remaining tissue. There's a chance of explosion because it's high energy. Laser is a high energy and light and can be transmitted, and that's why there should be training before using any laser. You have to do safety training. The advantage of laser, it has less bleeding, less vibration, less invasion, effective appointment. It has a wow effect because we did surgery on laser, which it's laser. When you say laser, is a big deal. So most of the dentists, they use laser. They have it on their on the outside of their sign. We have laser, but the thing with laser, this is the advantage of laser a lot. We can say forever. It's sterilization. You have less pain. You have less bleeding. You have less damage to the remaining tissue. You have a lot of things. Sterilization, especially when you do root canal, removing of the bulk of the tissue. If there's a tumor, abnormal tissue. All these less energy, less damage to the adjacent tissue structure. But I want to keep saying there's more stuff. There's expensive. Laser is highly, highly expensive. You need a lot of training for it. You need all these devices. Imagine if you make filling, you need filling and a tooth. You can use erbium yak, but imagine this patient has an old silver filling. The erbium yak don't cut the silver filling because it's different wavelength as a metal. So you need another laser to cut the metal filling. So while if you have a hand piece will cut the tooth and cut the metal at the same time. So sometimes it's overestimated advantages. You need a lot of training. You need a protection. You need a hazard. And there's when you cut the teeth, when you cut the gum with the scalpel, you feel it. You feel it when you touch the bone, you reach the bone. With laser, we don't have actually that tactile sense. We don't have the feeling. Especially when you wear CO2 laser. CO2 laser, the handpiece is not touchable. You're not touching the tissue, so you burn it away. And when you use infrared, ultraviolet laser, they are invisible. They need another light, which is visible laser, to adjacent. Sometimes they are the visible light and the cutting light, they are not over each other. Sometimes, so the cutting would be not the same, not precise. So these are disadvantage of laser, but laser is a promising. It's the future. All these are friends. Thank you. Stop sharing. Okay. Any question? Did you get it? No one, no question?
No, sir, I'm good.
You good?
Yes, sir.
So what do you think about laser? What do you think?
I think it looks pretty painful.
Usually painless because it's okay. When you cut with laser, I'll show you the videos one day. When you cut with the handies, there's vibration, there's a sound that's everybody hate with the turbine. With laser, there's different sound and there's no vibration. And especially when you work with the gingiva, you cut and there's nothing, there's no bleeding. Okay, Ashland, Wednesday, we should be here by 12 something, 12:30, after 12:30, 12:45, it's fine.
That's at the dental lab, right?
Yeah, we'll be here at dental lab because there's people coming here and they want to see us. But if you want to come tomorrow, we need to organize, and I will give you everybody. Need to give you a cabinet, and you can put your stuff underneath when you finish, and you can bring your stuff, and I will give you a box. You can put your cost and work, so we can take it home when you work. I have a few. I don't know if we have enough for you guys, but at least you will have your own space. We can keep it clean and you can put your name there. So when people come and see you, at least, you know, so if you can come tomorrow, we just need to organize and remove some of the stuff, we throw stuff. And so Wednesday will be more ready for the visitor, if you can. Is that okay?
Fine.
Okay. I'm gonna put more essays and stuff, quizzes for the lectures. So, and don't worry about, I will have the final grading. So even if you didn't give 100%, it's fine because I will take care of other stuff. And we need you tomorrow and Wednesday. Is that okay? If you don't have any other question, so yeah, you can go.
Hey, Dr. Jenny, were you ever able to get my course unlocked?
I asked her, she didn't answer me. Can you email her too? Because she's very busy.
Yeah, I will.
Yeah, thank you very much.
No problem. See you on Wednesday.
See you. Thank you very much. Bye, guys.
Bye. Have a good day.
Thank you. Bye.